Welcome to the Deep Dive. Today we're diving into the world of chronic liver disease. We've got this medical training document. It outlines a patient case, and we're going to use it to understand how doctors diagnose this condition.
Sounds fascinating.
It is. So picture this. You're a doctor examining a patient. You start noticing things like a slightly enlarged liver. Maybe you see some spider veins, maybe some bruising. And you realize these aren't just random symptoms. They're red flags that could point to chronic liver disease. So our goal today is to try and understand what this disease is, how it presents itself, and what steps doctors actually take to figure out what's going on.
Makes sense.
Yeah, so the document jumps right in and describes our patient. They've got jaundice, an enlarged liver, spider naive, easy bruising, and weight loss. So what do these symptoms tell us?
Well, they're classic signs of chronic liver disease. But it's like having one piece of a puzzle.
Yeah.
We need more information to really see the full picture. The symptoms themselves don't tell us the cause. So it's like detective work from here.
Okay, so where do we start looking for answers?
Well, the document points to some of the usual suspects, at least in the UK, alcoholic liver disease. And non-alcoholic fatty liver disease are the most common causes.
Yeah, those are the ones we hear about a lot. But globally, I think the document mentioned viral hepatitis is a big one too.
Absolutely. Huge global impact.
And it doesn't stop there. We've got autoimmune disorders, conditions like PBC and PSC, genetic conditions, even medications are on the list. Wow, that's a lot of potential causes. How do doctors even start narrowing it down?
That's where a doctor's expertise and a really systematic approach come in. And the document actually outlines that entire process. It starts with a thorough history, comorbidities, drug history, alcohol use, travel history, even family history is important. It's like building a profile, connecting the dots between their life and their condition.
Okay, so gathering clues. What's next?
Then comes the blood work. Full blood count, UNEs, LFTs, coagulation screen, bloodborne virus screening, ferritin, immunoglobulins, keraloplasmin, autoantibody screen. I know it seems like a lot, but each test targets a specific thing.
So it's not just looking at everything. It's more like using a metal detector to find specific coins on a beach instead of digging up the whole beach.
Precisely. Elevated liver enzymes can indicate damage, but they don't tell you the source. So think of those elevated enzymes as a smoke alarm. We know there's a problem, but we got to investigate to find the actual fire, right?
Makes sense. And what if the blood tests don't give us the whole answer?
Well, then we have imaging studies, ultrasound, CT scans. These give you a visual look at the liver, help see any structural changes or abnormalities. There are even non-invasive options like the fibrotest and fibroscan to assess liver fibrosis.
Liver fibrosis, that's the scarring of the liver, right?
That's right. Fibrosis is like the liver's way of patching up damage. But over time, too much scarring can stiffen the liver and mess up its function. It's kind of like, imagine a scar getting bigger and tighter, restricting movement.
Oh, okay, that makes sense. So we've got blood tests, imaging, but the document also mentions checking for specific antibodies. Why are those important?
Well, antibodies are like the body's special forces. They target specific invaders. You've got ANA, AMA, smooth muscle antibody, LKM antibody, and then tuner markers like AFP for HCC. Finding these specific antibodies can really narrow down the possibilities.
So it's like finding a suspect's fingerprints at a crime scene, directly linking them.
Exactly. And the document actually gives us a specific scenario. They describe a patient with positive antimitochondrial antibodies and elevated IgM.
So what does that tell us?
That combo strongly suggests primary biliary cholangitis, or PBC. It's like finding that fingerprint, a strong indication of the cause of the liver problems.
All right, so we've identified PBC as the likely culprit in this case. Can you tell us more about this condition?
Sure.
The document mentions fatigue and itching as common early symptoms, but it can lead to more serious liver damage. Even cirrhosis over time. That sounds pretty scary.
It can be, which is why early diagnosis is so important. The earlier it's detected and treated, the better the chances of slowing its progression.
Makes sense. Speaking of treatment, the document highlights ursodeoxycholic acid as the primary treatment for PBC. Along with quitting smoking, of course. What does this medication actually do?
Ursodeoxycholic acid can be a game changer for people with PBC. It helps move bile, the fluid the liver produces, out of the liver and into the intestines. This reduces the buildup of bile in the liver, which can cause damage.
So it's like unclogging a drain.
Exactly. And it not only helps with symptoms like fatigue and itching, but it can also slow down the progression of the disease.
Wow, a win-win. But what happens if PBC keeps progressing despite the treatment? Is there anything else that can be done?
In severe cases where the liver is really damaged, A liver transplant might be the only option.
That sounds like a major step.
It is, but it can be life-saving for people with end-stage liver disease.
So we've gone from those initial, seemingly common symptoms all the way to diagnosing and treating chronic liver disease, even touching upon the possibility of a liver transplant.
It's been quite a journey.
Indeed. But we're not done yet. In part 2, we'll delve deeper into those less common causes, exploring those autoimmune disorders, genetic conditions, and even those medications that can impact liver health. So stay tuned.
Looking forward to it. Welcome back to our deep dive into chronic liver disease. In part 1, we talked about the common causes like alcoholic liver disease and viral hepatitis. And you know how doctors use medical history, blood tests, and imaging to narrow down the potential causes.
Right, but we only got a glimpse of how many other things can cause chronic liver disease. The document mentioned autoimmune disorders, genetic conditions, even medications. It's kind of overwhelming.
It can be, but that's why this whole investigative process is so important. Each potential cause has its own unique, you could say, fingerprint.
Right, like those antibodies we talked about.
Yeah.
So let's unpack some of these other causes, starting with autoimmune disorders. What exactly is happening in the body when we talk about autoimmune disease?
Well, you can imagine your immune system as a security guard, right?
Yeah.
It's protecting your body from invaders like bacteria and viruses. But in autoimmune disorders, this security guard starts mistaking the body's own cells for intruders, and it attacks them.
That's like friendly fire.
Exactly. And when it comes to the liver, there are a couple of key autoimmune conditions. We already touched on PBC, or primary biliary cholangitis, but there's also PSC, primary sclerosing cholangitis.
We talked about how PBC affects the smaller bile ducts in the liver. What about PSC? How does that one work?
PSC is kind of like PBC's more aggressive cousin. It also targets bile ducts, but instead of the small ones, PSC attacks the larger bile ducts, both inside and outside the liver. This causes inflammation, scarring, and eventual blockages, and that disrupts the flow of bile.
So both conditions involve bile ducts, but PSC is more widespread, affecting a larger part of the
You
system.
got it. And because of these different patterns of damage, doctors can often tell the difference between PBC and PSC using imaging studies, like MRCP, which gives detailed pictures of the bile ducts.
Okay, that makes sense. Now let's shift gears to those genetic conditions the document mentioned. Hemochromatosis, Wilson's disease, and alpha-1 antitrypsin deficiency. Can you tell us about those?
Sure. These conditions are all related to problems with how the body processes and stores certain substances. It's like having a faulty filing system where things get misplaced and pile up.
Okay, a filing system gone wrong. Walk me through each one.
All right, let's start with hemochromatosis. In this condition, the body absorbs too much iron from food. Iron is important for our health, of course, but too much of it can be toxic. In hemochromatosis, this excess iron builds up in organs, including the liver, and that causes damage over time.
So the liver is like a storage unit that gets overloaded.
That's a great analogy.
Yeah.
And it's important to catch it early because the damage can be reversed if you start treatment before it gets too severe.
And what about Wilson's disease? That one also involves a buildup, right?
It does, but instead of iron, it's copper that accumulates in Wilson's disease.
Mm-hmm.
And copper overload can affect not just the liver, but also the brain and eyes, leading to neurological and psychiatric symptoms.
So Wilson's disease can be much more than just liver problems.
It can be, yeah.
Yep.
But thankfully, it's treatable with medications that help remove the excess copper.
Okay, good. And lastly, we have alpha-1 antitrypsin deficiency. What's the deal with that one?
Alpha-1 antitrypsin deficiency is a little different. It's a condition where the body doesn't produce enough of a protective protein called, well, alpha-1 antitrypsin. This protein helps protect the lungs and liver from damage caused by inflammation.
So it's like not having enough padding to protect those organs.
Yeah, that's a great way to think about it. And without enough of this protein, the liver can become inflamed and scarred over time.
So with this one, it's not about something building up, but rather something missing.
Exactly. And it really shows how important it is to understand the specific mechanism behind each condition, because that guides the treatment approach.
Makes sense. The document also mentioned a condition called HHT, or hereditary hemorrhagic telangiectasia. Anything you can tell us about that one?
HHT is a bit different from the others. It's a genetic disorder that affects blood vessels, causing them to form abnormally. Now, while HHT can affect different organs, in the liver, it can lead to these abnormal connections between arteries and veins.
So instead of like nice organized pathways, there are detours and shortcuts in the blood vessels.
Exactly. And these abnormal connections can disrupt blood flow and potentially lead to complications, including liver damage.
Oh, wow. And we can't forget about medications. The document emphasized that even those can cause liver damage.
Oh, absolutely. Some medications can be toxic to the liver,
Yeah.
especially in high doses or when taken for a long time. It's like anything else, too much of a good thing can be harmful.
So it's a good reminder to be aware of the potential side effects of any medications you're taking and talk to your doctor if you have any concerns.
Definitely, especially if you have a history of liver problems.
Right. So we've talked about autoimmune conditions where the body attacks itself, genetic conditions where the body mishandles substances or lacks essential proteins, and even medications that can cause unintended harm. What's the key takeaway for our listeners about all these different causes?
I think the biggest thing to remember is that chronic liver disease isn't a one-size-fits-all condition. There are many different paths that lead to liver damage, and understanding the specific cause is essential for finding the right treatment.
It's like a detective novel. There are multiple suspects, and we need to gather the clues to find the culprit.
That's a great analogy. And just like in a good detective novel, early intervention is key. The earlier we catch and address liver disease, the better.
That's a great point. So we've explored the many faces of chronic liver disease, from the common to the less common. But what happens when the damage is already done and the liver can't function properly anymore?
That's when a procedure called liver transplantation comes into play. It's a complex and challenging procedure, but it offers hope for those with end-stage liver disease.
That's the perfect segue into our final part. In part 3, we'll delve into the world of liver transplantation, exploring the challenges, the hopes, and the impact of this procedure. Welcome back to the final part of our deep dive into chronic liver disease. We've explored the many causes and the whole diagnostic process, but now we're shifting gears to a topic that's both a challenge and a beacon of hope: liver transplantation.
A big one.
It is. In the previous parts, we discussed how chronic liver disease can lead to severe liver damage, and the document mentions liver transplantation as a last resort when other treatments have failed. It's almost like a reset button, right?
Yeah, in a way, when the liver is so damaged it can't do its job anymore, a transplant can give people a second chance.
So it's literally life-saving. Can you walk us through what actually happens in a liver transplant?
Well, it's a major surgery. They remove the diseased liver and replace it with a healthy one from a donor.
And where did these donor livers come from?
There are two main sources: deceased donors who registered as organ donors and their families consented to donation after they passed.
Such a selfless act.
It really is. And then there are living donors.
Living donors?
Yeah, the liver can actually regenerate. A living donor can give a portion of their liver, and both their liver and the recipients will regrow.
Wow, that's incredible. So a part of a liver can be transplanted and both livers eventually become whole again. Amazing.
It is, but of course, living donation is a big deal. It involves a careful evaluation to make sure it's safe for both the donor and the recipient.
The document doesn't really go into detail about the surgery itself, but it does mention some of the challenges involved in transplantation.
Yeah, for sure.
What are some of the biggest hurdles?
Well, one of the biggest is organ availability. There are simply more people who need livers than there are donors. So there's often a waiting list.
That's understandable. There are only so many donors.
Exactly. And then there's the complexity of the surgery itself and the potential for complications, both during and after the
But
transplant.
even with a matching donor, it's still a major surgery.
It is. And we also can't forget about the commitment transplant recipients have to make. They need to take immunosuppressant medications to prevent their body from rejecting the new liver.
Right. The body's immune system is always on guard. It needs to be retrained to accept the new organ.
That's a good way to put it. And these medications, while essential, can have side effects and require careful monitoring.
So liver transplantation is a complex journey with both benefits and challenges.
Absolutely. It's life-altering and requires careful consideration of the risks and benefits.
This deep dive into chronic liver disease has been fascinating. We've gone from common symptoms to understanding a wide range of causes, a detailed diagnostic process, and even touched on the life-saving potential of liver transplantation.
We've covered a lot of ground.
We have, but I think what's really important is that early detection is key. If you're experiencing any of those symptoms we talked about, fatigue, jaundice, abdominal pain, don't ignore them. Talk to your doctor. Early diagnosis and treatment can make all the difference.
Couldn't agree more. The earlier we catch it, the better the chances of slowing it down and maybe even avoiding a transplant.
So as we wrap up this deep dive, what's the one thing you hope our listeners will take away from all of this?
I think the most important thing is that knowledge is power. The more you know about your body and about chronic liver disease, the better you can advocate for your own health and make informed decisions.
Well said. And that's what the deep dive is all about, empowering you with knowledge. We hope you've enjoyed this journey into the world of chronic liver disease.
Thanks for having me.
It's been a pleasure. Until next time, keep exploring, keep learning, and remember, knowledge is your best defense.